No matter what the orientation, analysts must make trade-offs concerning how they go about studying and ultimately addressing the problems that they face. As such, there are several different approaches to policy analysis. The first concerns, what are you going to study? The root causes of the problem or the proximate causes of the problem? Root causes are the fundamental causes of public problems. Sometimes we refer to these as the underlying causes, or basically, the thing that is truly driving the problem. Proximate causes are those things that are kind of most direct or immediate. Sometimes these are things that are easiest to see and ultimately handle. The way I always like to think about this is when a person doesn't feel well. The proximate causes are symptoms. They're things like a headache, a sick stomach, or even a fever. The root cause is what is actually making you sick, something like a virus or a bacteria. Thus, if you go to the doctor, what do they seek to deal with? Are they going to deal with the symptoms and prescribe you some sort of medicine that deals with the fever or the sore throat or the sick stomach? Or do they prescribe you something to deal with the cause of the sickness, be it the bacteria or the virus? Policy analysts thus have to figure out what they want to focus on, trying to deal with the root causes to the problem or the proximate causes to the problem. The choice they make affects what the ultimate policy they decide upon will look like. Take, for example, the problem of homelessness. What are the root causes of homelessness? And further, what are the proximate causes of homelessness? The proximate cause might be something at the surface level, something easy to see, like they've lost a job. The root causes might be something deeper and harder to address, stuff like mental health issues. Ultimately, policies addressing homelessness will be radically different depending if you decide to go after the root or the proximate causes. Policy analysts also have to make a trade-off between the time horizon of the policy they're going to examine. They can pursue the most comprehensive and rigorous approach available to ensure the credibility of the results, even though it takes longer and costs more. Or they can aim for a less comprehensive and rigorous study to provide pertinent results faster and more cheaply. However, there is a risk to the credibility of the results. Again, for example, take the issue of homelessness. However, let's focus it and think about homelessness among veterans. What would a comprehensive policy to address homelessness among veterans look like? Further, what would a short-term policy look like? A comprehensive policy might address homeless veterans as well as those veterans that are at risk of becoming homeless, with a multi-pronged approach that addresses things like permanent housing, health and mental health care, career development, and ultimately access to Veterans Administration benefits. A short-term policy could be something like a one-and-done policy, like creating a job training program for veterans that lasts maybe 6 months and gets them back on their feet and they're through. The next approach considers the route that the policy analysts might take in addressing the problem. Do you follow the consensual or the traditional approach, in which you use the tried and true methods to address the problem? Or do you try the contentious or more radical outside-the-box thinking to address the problem? The choice you make often can be determined by the scope and salience of the problem, the resources available, and the time you have to actually address it. Sticking with our example of homelessness, what would be a traditional way to address it? Further, what would be a more outside-the-box or radical way to address this? Well, if you're thinking more traditional, how about a city build a homeless shelter to address it? If you're thinking outside the box, what if a city gave homeless persons a home of their own and some aid to get their lives back together? You think this is radical? Well, it's actually been used before. The state of Utah back in 2005 did exactly that. They actually gave homeless individuals a place of their own to stay. They realized it was costing the state more to deal with individuals that were on the streets than it was to actually give them a place to stay. Within 10 years, the state of Utah reduced chronic homelessness by 91%. Can you believe it? The final approach is in trying to figure out what the problem is and how to address it. Do you follow the rational approach, which is logical, efficient, effective, which engages in technical scientific analysis of the problem and complex risk assessment to figure out how to address it? Or do you act more democratically and bring citizens into the process, soliciting public support and input to figure out what the problem is and ultimately what they would like to see done? An example of this rational approach would be a city trying to conduct a study to discern the reasons for why people are homeless. A more democratic means would be for the city to set up a citizen advisory committee to decide what should be done to address the issue of homelessness.